With the patient lying supine and their knee flexed to 90, locate the patellar tendon with your hands placed behind in the popliteal space. Then, moving laterally, you find the meniscal windows. Moving inferiorly, you will find the tibial plateaus. Then, palpating from the patellar tendon and inferiorly, you will locate the tibial tuberosity. With the patient still in the supine position with their leg bent at the knee joint at 90 degrees, moving from the meniscal window upwards on the medial side of the patella with thumb still in joint line, you will palpate the medial femoral condyle. Then from there, palpating even further medially will help you to find the medial femoral epicondyle. Now beginning at the femoral condyle, palpate medially and posteriorly until you feel a bony prominence at the distal end of the natural depression between the vastus medialis and hamstrings. This will help you locate the adductor tubercle. Beginning at the lateral meniscal window and palpating superiorly and laterally, you will palpate the lateral condyle. Then moving even more laterally will help you to find the lateral epicondyle. Have the patient seated at the edge of the table with their leg hanging off and the tibia internally rotated. Then, palpating along the medial joint line, you will locate the meniscus. Then, to palpate the MCL, you will locate the medial joint line in the meniscal windows. Moving medially and posteriorly along that joint line, that would be the region where the MCL is located, although we would not be able to feel it unless it was injured. The lateral meniscus can be palpated by probing your thumb into the meniscal window and the joint line. Then, to palpate the LCL, you will have the knee flexed to 90 degrees and the hip abducted. Then you will be able to find the cord-like structure that runs from the lateral epicondyle to the fibula head. With the patient still seated at the edge of the table, stabilize their leg with your own. Then palpating from the tibial tubercle, move medially and posteriorly while the patient attempts to flex their knee while you resist. This group of muscle and tendons are known as the pes anserine, and just medial to the insertion under where the tendon lies is the pes anserine bursa.